everything from childhood can get contributed into the sexual narrative. And one of the ways to understand this in terms of working with clients is I call it cracking the erotic code. So in other words, there's an erotic code that's embedded in that sexual narrative that's non-sexual. And if you tell me all the details of what you're interested in, what you're doing sexually and erotically, I can then help you, if I've done the genogram, possibly look back and see what things are from what. Not everything is from something, but some things are. Like, so let's talk about this. This isn't trauma, nor is it abuse, but it affected the client. I had a client who was into women who were amputees, and you didn't need to watch porn. You can just get on the internet and watch it on YouTube, and and just watch a woman trying to get around without a limb, a leg, one or both legs. Very erotic, and it was concerning him. He felt a lot of shame, and because also the Me Too movement, he didn't like objectifying these women. It turns out that he was raised in a household with a fully able-bodied mother, but she was so depressed she couldn't get off the couch, so they lived on government assistance. Across the hall was a woman who had a missing leg, but she worked every day and went up and down the stairs from the apartment, and he would offer to help her with groceries, and she would say no, but come and come and be my visitor, like keep me company. And so when his sexual orientation kicked in, it was to women. When his erotic orientation kicked in, it was to women who were amputees. Now, a lot of people may look at that as, well, maybe he was traumatized as a child, and maybe it is linked. But it doesn't matter even if it is. What matters is to help him do that work and recover from what happened to having a depressed mother. But our fantasies right the wrong. We go from victim to victor. That's what that's all about. And it's an attempt toward health, not attempt toward pathology. And the more you pathologize somebody's fantasies, and the more you even give into, a lot of clients come in and they say, I want this out of my head. Slice it out. I don't care how you do it. Well, I always tell couples and individuals, there's no such thing as an eroticectomy. You can't have an eroticectomy. You can't cut it out. You can learn to lower the volume. You can add to your sexual and erotic interests, but you can't necessarily get fully rid of kinks, fetishes, and strong, early imprinted fantasies that happen from childhood.